Davey was first diagnosed with diabetes right outside of third grade, so he was 9 years old, about a year and a half ago. He had flu-like symptoms. He was basically starting to feel he was very sick, and he was just starting to get a little bit, I thought, getting better because he could drink a little bit more, keeping fluids down. Only he kept losing weight. Like overnight, he seemed to lose a lot of weight. And he just kept telling me, and I mean, I have 6 children, so I've done a lot of flus. But in this case, his eyes were really dry. He kept telling me, my eyes are so dry. That was at night, and I said, we're going to the doctor tomorrow. Even though he was keeping fluids down, he was not, he was still very dehydrated. I'd say the most difficult part about managing Davey's illness was just getting used to having this new routine. And we had a lot of help, and a lot of information out there through the hospital, through the doctors, diabetes nurse, diabetes educators that helped us. But it was still getting used to having to do that and always know what his blood sugar was. We do his blood sugar 4 times a day. I guess the advice that I would give to other mothers who are managing diabetes is to get connected. That to me was the biggest help that I had. There's so much help out there, people who've already figured this out, so you don't have to reinvent the wheel. You can just learn from other people. That was one of the biggest thing, is to get connected and stay connected. And I also would say to remember that your child, and I know with my child, Davey, is an individual, and he's not going to be like everybody else. So just to work with that, and just try to work the best I can with him, his symptoms, and however he's dealing with it. I just not to panic. It gets easier. That is the truth. Everybody that I've talked to, they say it gets easier. At first, it's like a big shock, and it's like you don't even know or even have time to think, how am I ever going to get through this? But then it's just, and what somebody once told me is, you don't have to conquer this. You just learn to manage it, and that's what you do, day by day, manage it.
Well, I have 2 necklaces. This one says diabetes, and then I have 3 bracelets, and this says pretty much the same thing. What I like about the straps is that they're all different from each other, like blue, camouflage, and then green.